Thank you for meeting us. I'm Mariam Al-Hamiri and this is...
Nice to meet you, Doctor. Today, we'll be talking about your background, your work at Kanad Hospital, and your vision for healthcare. We'll be dividing the questions between us.
First question. Can you tell us about your background in medicine and how you ended up at Kanad Hospital?
Yeah, thank you for inviting me. It's very nice to be here. So lovely to meet you, Mariam. Lovely to meet you, Faisal. This is a lovely place to be. Just walking into the school this morning, you have such a nice atmosphere. Lots of people talking and chatting. It's obviously a really happy place. So it's a real pleasure to come here. So you asked about my background. A long, long time ago, I was a school student as well. And I can remember probably age 13, 14, something like that. I wondered, scratching my head, what do I want to be in life? And I loved helping people. I loved talking to people and being around people. But I also love science. So I remember when I was a child thinking, how do you combine science and people? And medicine seemed like the obvious choice for me. You get to help people, you get to be kind to them, and you get to use your mind as well. So you have to think hard, study hard, make a diagnosis, find the right treatment. So I love being a doctor.
I heard you studied at Cambridge University. How did that experience shape you as a person?
Wow. I was very blessed. So, praise God, I was blessed with some ability to pass exams. And so I was able to go to Cambridge and had a wonderful time there. It's got a good reputation as a university. And, when you stand on that foundation, you can stand a little taller, go a little further. So I was really blessed to go there. It was also a very caring and warm place. It's not harsh or old. Some people imagine the big old universities will be difficult, but it was great fun, actually. I really enjoyed my time there.
Did you have any mentors or experiences that helped you throughout your experience?
Oh, for sure, and so many. I think it would be wrong to name one individual person, but so many older people. Obviously, in my field, in medicine, you're meeting doctors all of the time, and all of them are good people. Nearly all of them. So doctors love to help people. I'd also emphasize, I was very inspired by nurses and even healthcare assistants. At one time, I even thought about switching from medicine to nursing. Doctors have a different relationship with a patient. Let me say that again. Doctors have a different relationship with a patient than a nurse has with a patient. Nurses touch them more. They lay hands on the patient and they really care in a different way. And I love that gentleness, actually. I really admired and respected the nurses and the healthcare assistants around the hospital.
Faisal, you can go ahead.
Okay. Doctor, here's something I would like to know. I've been wanting to know for a while. Can you describe your current role at Kanad Hospital? I want to know what's your current role, and give me the details. I would like the details.
Yeah, thank you, Faisal. So I've been at Kanad Hospital for about 2 years now, and at the start of this year, I became the managing director. Kanad is an amazing place. It is the first hospital in UAE. A couple of doctors called Pat and Marion Kennedy came from America at the invitation of Sheikh Zayed, Allah yarhamah, and he invited these two Christian doctors to come and work in the middle of the desert, really. Al Ain at that time was a tiny place. They say around about 2,000 people. And of course, that included Al Brahimi. There was no division. So at that time, it was a small place. But imagine if you're Sheikh Zayed or one of the tribesmen and you needed healthcare, you either had to go 3 days on a camel, approximately, to Muscat, or you had to go 3 days by boat through Dubai to Bahrain, because that was there was a hospital in Bahrain and there was a hospital in Muscat, but there was nothing here. And so Sheikh Zayed, in his wisdom, invited Pat and Marion Kennedy to come and found this hospital. So that was 65 years ago. I have only been there for 2 years, and I feel the weight of responsibility on my shoulders to maintain this wonderful thing that Sheikh Zayed created. Thank God. This year, Sheikh Mohammed bin Zayed gave us such nice remarks about the importance of this hospital to the diplomatic relations between UAE and USA. So clearly there is still a strong respect and love, affection for Kanad. One other thing I would say, we are the first and we are also the best. And our competitors might not like to hear this, but we still today, we are by far the safest place to have your baby. So we focus on safe motherhood, safe childhood, and the comparison between our statistics and some other hospitals near here, we are a lot better. It is not even close. We are the best hospital for mothers and babies.
All right, I understand that, and I really like it. Question, what would you consider your most significant achievements in your work there?
One thing I can do is build a team. So already we had a great hospital before I joined. I've only been there as the leader since the start of this year, so I cannot boast that I created these statistics. But one thing that I really enjoy is bringing people together. So these days we have a lot more Emirati staff. If you guys want to apply for a job, see me afterwards. So we have a lot more Emirati staff. We have a complete mixture. On our executive, we have 7 executives, and they are from 5 different countries: Nigeria, Zimbabwe, India, USA, UK. Is that everyone? I've forgotten. But you can see the huge variety that we have, even in the executive team, and that spreads down into every level in the hospital. So sometimes you'll find if you have a big group of, say, Europeans and a big group of Filipinos and a big group of Indians, they will be quite separate. But I like to bring people together. So we are still working on that. You will never have the perfect team, but hopefully we can achieve more together. Oh, you know the saying, TEAM stands for, you know?
No.
Together, everyone achieves more. TEAM. Together, everyone achieves more.
All right, I like the answer. How does Kanad Hospital balance patient care with community outreach?
Lovely question. We feel like part of the community always. So I guess if you come into the hospital, we want you to feel at home. So one of the ways that we do that is all of our staff must learn Arabic. We grade our staff and we give them free lessons, and we have a team of Emirati teachers, so they are learning Rams al-Emiratiyya. I had to learn some Arabic when I started. So, you know, you take a Indian nurse who is new to UAE, and to make you feel at home when you come, we need to teach that Indian nurse some Arabic, and just the warmth of coming into our hospital. So many people comment when they come in, they feel at home. But also we go into people's homes. So this goes back to 1960. All the time, the hospital staff would be visiting people in their homes or in their azab, and they would be, just enjoying coffee or the biha. They'd be enjoying their time with locals. Way back to 1960, and we have continued that. Very specifically, we always visit babies after birth. So if you're a local and you live in Al Ain and you have a baby at Kanad, for sure two of our nurses will come to your home to visit you. That really helps mom to learn about breastfeeding, to learn how to look after the baby, of course, and it builds relationship between the mother and the father and the hospital. So we are routinely every week, every day, in people's homes.
Oh, nice. So basically, when you said about like that every single new worker has to learn Arabic, so basically one of the criteria of joining, of having this job is learning, is being bilingual?
Oh, I would, to a certain extent. So we teach to level 2, that is compulsory, and a lot of our staff will go further. I really enjoy Arabic. So to a certain extent, but our nurses will understand, if people, I have pain, they will understand where the pain is. So, bilingual means that they are nearly perfect in 2 languages, but our nurses are good and our doctors are good. It's always best to find somebody who's spent a long time in the Middle East, people who are born in the Middle East, Arabs themselves, of course. We have a lot of Arabic staff, doctors in particular, and this helps communication. But for me, for the senior doctors around the hospital, we had to learn to try to become bilingual.
Oh, all right. Thank you for your answers. I'll pass it back to Mariam for the next part.
What are the biggest challenges you face in healthcare today?
Ooh. Healthcare has changed so much. His Highness Sheikh Mohammed bin Zayed told us when he was speaking to Donald Trump earlier this year that in 1960, the death rate, imagine this, the death rate was 1 in 2 amongst babies. So think about your brothers and your sisters, cut that in half. I mean, it's a scary thought, isn't it, if you imagine that half of your family does not exist. So the needs back then were so different. Today, we're focusing on living longer, I think. So it's not just staying alive, it's living longer and with a higher quality of health. So for me, in my specialty, I focus on family medicine, and I still have 1 day each week in clinic. We're always focusing on prevention. So number 1, stopping smoking is not new science. This is very old, since at least 1960 and before. People have known that smoking gives you cancer and lung disease and strokes and heart disease and dementia. So, the simplest thing anybody can do to improve their health is to stop smoking. And then number 2 is diet. So obesity is a big problem. That's a joke. Big problem. It's a big problem.
I get the
point. And it's both of those things. Sometimes the people who are struggling with cigarettes or struggling with food, they're really struggling. It's not their fault. They're not, they're not able to stop. So as a doctor, enabling people to look after their own health is a massive gift. So as the population lives longer and gets older, prevention, stopping diseases further down the track is really, really important.
جربتوا طرق جديدة في العلاج؟
قد جربنا طرق جديدة، قد انقلبنا للغة العربية الحين. زين، شو من طرق جديدة؟ شو قصدك؟
Technology.
Oh, technology. Oh, we have such great technology in so many departments. I mentioned that we are the safest place to have a baby. So our neonatal, that means newborn, intensive care unit, our neonatal intensive care unit has fantastic equipment, and they are using it in a different way. So many hospitals will have histograms. This is a way of looking at graphs. I think you might study histograms in math or in science. But histograms can be used in healthcare to look at how the oxygen level in a small baby changes over minutes or over hours. So by watching these detailed charts very carefully, we have actually improved survival rates in our neonatal intensive care unit. And that's just one example. We have lasers for eye surgery, and we have all of the modern medicines. I would always say technology can be very flashy, but it's knowing how to use it that is the important thing. So one example is robotic surgery. People go crazy about robotic surgery as if a robot can do a better job than a person. But remember, the robot is being controlled by a doctor in the next room. So if the doctor is not good, the robot is not good. And so robotic surgery in general does not have massively different outcomes from a human surgeon using their hands.
You mentioned your team quite often. How do you encourage your team to adapt to new healthcare trends?
Oh, well, they tell us what we need to adapt to. So as a leader, you want to employ clever people. My specialty as a doctor is family medicine, so I cannot be on top of neonatal intensive care or general surgery or obstetrics. I cannot be on top of every area, and I will not be the one encouraging those people to do new technology or new techniques in their field. But if you are a good leader, you will employ good people, and they will come and they will tell you what needs to change. So several of our doctors are involved in research. They are developing new technology, not just using it. They are creating new techniques and new ways of doing things. It's exciting to work with a really strong and empowered team.
So you can go ahead.
Okay. Here's a question I've been thinking about for my future, just in case I would like to have the same occupation as you. How do you define effective leadership in a hospital setting? So just like if I want to get some leadership over my staff, if I'm the same occupation as you, if I want to get some control over my staff and tell them what to do, or if there's like a patient in intensive care or something, I would like to know how to have effective leadership over them.
Mm-hmm. I'll go to an Arabic phrase. So Sayyid al-Qawm khadimhum. So if you want to be a great leader, you need to be a great servant. Okay. So leadership is not about pulling people, saying you have to come on this journey with me. I'm going to make you come. That's not leadership. Leadership is a group of people all wanting to go to the same place, and you find the map. And you say, well, to get to that destination, we need a map, and we're going to need some supplies, and we're going to need shoes on our feet, and we're going to need clothes, and together you get everyone organized so that you can go to that destination. So that is an act of service. I work a lot of hours each week, so our staff might imagine, I don't know what they imagine. They might imagine that the leader is there for the staff meeting on a Monday morning, and then he goes to the swimming pool. That is not leadership. Leadership is being there before everyone else, leaving after everyone else has gone home, and helping people on the journey to that destination. Some people will fall over, some people will get tired, some people will be injured. Being like a shepherd, looking after the sheep. You're not trying to take the sheep to slaughter. As a shepherd, you're trying to keep them alive, keep them together. So like a shepherd to a group of sheep, to the flock, you have to be looking after the sick ones, helping those who are struggling. It is like being a servant. So that's my style. And the other thing I would add is understand them. So I mentioned that as a student doctor, I really admired the nurses. I spent a lot of time being a nurse and being a nursing aide, in fact. So I was not a qualified nurse, I was a nursing aide. Learning to wipe people's backsides, learning to keep them clean, learning to pick up other people's trash, and learning to serve in that way, rather than being I'm the high and mighty doctor. People will see through you if you're leading for yourself. Your motive has to be to help other people. One more thing, this is a long answer, sorry. As a team, we're not just there for a nice walk on a sunny day. As a team at the hospital, we are there to serve the patients. So we always have to keep our eyes on what we are doing as a team. It's not just having a nice team atmosphere and all feeling warm and lots of hugs. The goal is to get these people motivated so that they enjoy helping others.
Oh, okay. I understand that. I like the answer. What advice do you have for young professionals aspiring to work in healthcare management?
Learn healthcare,
Yeah.
number one. So I think the best leaders have done a good amount of healthcare themselves. In my country, you can do like a degree course or a master's in healthcare management, and some people do that without having done any work in a hospital before. But I think the people who go through that stream sometimes need to step back and be patient, take a year or two after they've done their qualification to go to understand and empathize with the staff that they will be leading. So yes, you can just go straight into a healthcare management course, but it might be better to do some clinical work first. And again, you guys, I don't know what you do at your school. In my school, we had work experience. So we would have a couple of weeks at the end of the summer term, probably around grade 10, grade 11, grade 12. I cannot remember exactly. It's a long time ago, brother. So for 2 weeks each year, we would go into a place of work. So some people that was working in a factory or working in a management office. For me, I worked in a hospital laboratory. I worked on a ward. I actually worked in the hospital kitchen one time, preparing food for people. So, you know, these are different things that you could do to be a great healthcare manager.
But you had a long journey before you became manager.
Oh, for sure, yeah. So, I became a doctor, age 23? Okay, so you can do the math here. Became a doctor age 23. I came into healthcare management probably age about 40. So, yeah, for 16, 17 years, I was just a doctor, just seeing patients, just trying to make them better. But you know, having enjoyed that, I really do enjoy my clinic day still. Every Friday, I get to see patients, and it's a great day. So I still love patients. But fixing a patient and fixing a system have parallels. They're not the same, but they have parallels. So fixing a system, making the system healthier is wonderful as well.
Okay. Question: how do you foster collaboration among different departments of Kenneth Hospital?
We have something called the 4 disciplines of execution. This is quite a well-known method across a large range of businesses for improving execution. So execution does not mean killing people. Execution means getting the job finished. So to execute a task really well, you need to be disciplined. So the 4 disciplines are knowing what the task is. You need to set your goal, so be super clear on what you're trying to achieve. And then how do you get to that goal? I talked a moment ago about a journey. So how do you get to your goal? And then you need to have markers along the way. So are you hitting your targets? So the markers or the targets along the way, can you measure them? And can you even put them on a scoreboard to know, what is the score as you're going along? And then the 4th discipline is each team huddling, getting in a little huddle together every week to look at their scoreboard, to see if they're getting on with their targets and getting along this journey together. So in each department we have, I hope all of our departments are doing it every week. We have a 4DX, or the 4 disciplines of execution, and we have a huddle, and all of our staff are meeting around a scoreboard to see if they're progressing. We have one goal as a hospital, which is to try to make it a more attractive place for Emirati patients to come. So we want to see more Emirati encounters or visits, people coming to our hospital to really enjoy the atmosphere.
So basically, you have a lot of teamwork in your departments, right?
Oh, we certainly do, yes.
Oh, okay then. Thank you for your answers. I'll pass it back to Mariam for her next section.
You mentioned that you're managing director. Where do you see Kenneth Hospital in the next 5 to 10 years?
That's exciting. So we had a recent international accreditation, and one of the inspectors said, without doubt, Kenneth Hospital will be the destination of choice for maternal care in the Emirates. So I think one of our problems is that we are sometimes a little too modest. You're over here in Atawaya and Kenneth is over near Sanaya. And it's, people think between Adwaya and Kanad, it's a long way to go. And there are other hospitals, and all the hospitals are the same, right? No, they're not the same. So the hospitals are quite different. They have different focus, and they have different quality. They also have different atmosphere. So some will be focused maybe more on surgery. Some will be focused more on, elderly care. We have a focus on women and on children. So for young ladies who are giving birth to their first child, I have no doubt in my mind that Kanad is the safest place. We can prove it. There are statistics. So, we are perhaps a little bit too shy about talking about the quality. So there is a real difference, and we probably need to be a little bit louder. And then I think people will come from a little bit further. Right now, we have people coming down from Dubai or Sharjah, and they come to us because they feel safer at our hospitals. So maybe we'll be a little bit louder about who we are, and not to show off. That's not the goal. The goal is to tell people so that they know where to come when they need that help and that safety.
You talk about the good parts in your hospital. Are there any areas of healthcare you are particularly passionate about improving?
Yeah, one other area that I would like to see improved is my own specialty, so family medicine. So it's interesting that I'm a family medicine doctor by background, but I'm now leading a maternity hospital. Kanad does all the other specialties as well. So to have great healthcare for moms, you need to have healthcare for the whole family. So I want to see better family medicine. It's also known as primary care. Again, focused on prevention, so that we're treating everyone, in English we say from the cradle to the grave. So from the cradle to the grave, whole life healthcare. Again, in my home country, with family medicine, a patient will choose a doctor and usually will stick with that one doctor for 20, 30, 40 years. As long as the doctor is in that office, that patient will always choose to go and see, Dr. Richard or Dr. Mariam or Dr. Faisal. They will choose you as their doctor. So the long-term relationship is actually very healing in itself. And you as a doctor, you get to know, let's say I started to work with Faisal now, and then, in 10 years' time, he's married and he's starting his own family, and we're talking about him another 10 years later and measuring his cholesterol and talking about healthcare and orthopedics and his bad knee. And as the family medicine doctor, you're managing all of that. If you had a bad knee and you needed knee surgery in 20 years, Allah Satr, but if you ever needed an operation, you would go and see a surgeon, but you would also come and see your family medicine doctor to get a second opinion, to get advice and guidance. It's almost like a friend, because you get to know them so well over such a long time. So I'd love to see that model across UAE, where we have a sense of belonging, a sense of friendship with a doctor, and they can see you through your life journey.
And how do you maintain your work-life balance while managing such responsibilities?
Oh, you'd ask that question better to my wife. It's difficult, actually. And there's so many residents in this country, not citizens, but residents, and their family is somewhere else. I'm blessed, my children are grown up. My son got married this year. My daughter finished university. So they're strong, independent people. Oh, but I miss them. My heart is in the UK half of the time. So that balance between, speaking to my son and my daughter quite often, and then spending time with my wife here, trying to find that balance is difficult. I know some situations where it's even worse, where some of our employees have left their young children overseas, and that's really tricky for them. So, yeah, being in healthcare is a full-time, hard career that does require some sacrifices. But yes, we do need to work to find the balance.
Thank you, Dr. Brambel, for your time and your insight.
Sorry?
Thank you, Dr. Brambel, for your time and your insight.
Time and insight. Thank you so much. God bless you both. Beautiful questions.
We really appreciate the opportunity to speak with you today. Thank you again.
Thank you, Faisal. It's been a pleasure.